to another opportunity to ask questions and talk together about Vermont COVID-19 responses with some nurses from the Vermont Department of Health. And yeah, we're very pleased to have Sharon Lee Treffry and Sally Kirshner here to talk with us again. And they've already considered the questions you submitted ahead of time, and there is a Q&A box that we hope you'll use to bring up anything that either comes up for you during this presentation or this conversation, or something that's been on your mind. And I'm Brenda Metzler. I am a community and program support specialist with Let's Grow Kids, and my colleague Chris Nelson and I will be co-facilitating the Q&A. So we'll try to catch anything that Sharon Lee and Sally don't see themselves in the Q&A box. And so let's see, do we have any, oh yeah, housekeeping details. So, you are all muted, so we won't be able to take your questions by audio, but please do use the Q&A box. We really appreciate your questions, and note, as always, this recording and the PowerPoint that goes along with it will be posted on the LGK website. And any notes that come up from these conversations together will typically, especially if there are questions that we don't have time to answer fully during our time together, will be posted after Sharon Lee and Sally have a chance to provide their input, and we like to get those out by the beginning of next week. So welcome, and we hope that you get a lot of your questions answered today.
Great, thank you. Go ahead, Sally.
Great, so this is good to get on. We've done this a couple of times and have, we hope we are finding it useful. So we're doing it this year, this month, and Let's Grow Kids will check in with you folks to see if you want to continue these on a regular basis after the holidays. And as we talk and as we run out of time, you all know our warm line that you can call, I never call it, the 863-7240, number 5, that you're welcome to call us at any time, or not at any time, during like 8:30 to 8 o'clock to 3 o'clock on. We just answer it all the time. I forget that we have regular hours. So Monday through Friday, and of course, the health department is on duty over the weekends for emergency and really urgent situations. And so that's basically what we'll do today. And we want to always thank you folks for everything you're doing. Sharon Lee and I work very hard here with our team, but you folks are really out on the front line trying to do all of this and succeeding in doing all of this, in addition to creating and maintaining a really healthy, learning, fun, play environment for the children. So that's a key indicator of success, and we thank you very much.
And Sally and I are both live in the world of maternal and child health in all of our working career, actually. Sally is in injury prevention around children, and I have been a child care provider for 10 years in my home, and I've been a school nurse for 28 years, I think, if I count this work at the health department. So SNOT and fun and immunizations and not masks, but disease control have been part of what I'm very comfortable doing, well, along with all the science. So Sally, did you want to go over this one?
I'll give an overview, and Sharon Lee, you're welcome to jump in with specifics that you think are important. As most of you know, there's the Strong and Healthy Start guidance for the K through 12 schools began officially on November 16th. That came out several weeks earlier to give from the Agency of Education to give the schools time to prepare and get ready. So that has been implemented and in place for a couple of weeks now. Our childcare guidance is several months old. It's still accurate and valid, it does need tweaking and updating to include some things that would make it more congruent with the school guidance, but that is not something that's happened yet. We've just been too busy, I think, is the main reason, but we know that that's something that needs to happen, and some of that information that you may need is on the website. It's just not contained in the guidance. And then we also have the warm line that you call us folks if you have specific questioning. There's been a lot of questions on quarantining and the social gatherings. We're asking our people who run the website to work with our policy people to add a little bit of clarity, because people have been on the front line figuring that out. And that, a couple of thoughts to frame that. I think a lot of you have figured it out already. This, if we were talking right before Thanksgiving, it might have been a more intense conversation, but we've taken your questions. I know a lot of you have called us, and the schools have called us too, but the whole idea of the governor asking us to stay home because of what we learned from our contact tracing with active cases, that a lot of the cases, in case the contagion, to use that epidemiologic term, the contagion between people and families is from social gatherings, and not so much people going to restaurants or children in childcare or children in school. It's these social gatherings that people may let their guard down and not wear masks and get closer and hover over the turkey together to carve it and have a little glass of wine, that kind of thing. So that's why the governor focused on the social gatherings. And then that's where it got a little confusing, because, for example, we had a lot of questions about children going to social gatherings and then coming back to schools or childcare. Should they be quarantined? And some of our guidance on that is that you folks as child cares run your programs, and you can basically have your own policy as long as it is not any less lax than our guidance or the CDD guidance, and that you apply it equitably to all the families. And I think several of you we've been hearing do ask the families about, have they been recently in a social gathering, and you're asking that family to have their child quarantined. Then the tricky part comes up with a lot of family members are caretakers. And so then it looks like the family member sees the child all day long, but then it's like, oh, once comes Thanksgiving and the holiday celebration, the family member can't come. And that's where on the surface, it certainly sounds a little ridiculous. But what the problem is that we were seeing is that in a family situation, in an informal gathering, you don't do the masking and social distancing and wiping down like you would do if you were in your formal childcare setting. And then the family member comes, if it's the grandmother, and then the great uncle gets invited, and then all of a sudden you have a lot of people at Thanksgiving dinner. So the governor was talking about this in an effort to keep that the social gatherings minimal. So we're working on some new language for the website to help guide us and you folks, especially as the Christmas holidays come up, the Hanukkah holidays are here already, and also suggesting that to get out the message about suggesting that as families provide informal care, for them to remember to continue with good distancing and hand washing, and then those types of risk reduction activities that we might be asking an actual childcare teacher, early childcare teacher to be using. So those are kind of like all the thoughts spinning around. Once again, we give out this advice and guidance, and you folks grab it and put it into practice, and in a really good way. And it's confusing at first, and then we talk to you on the warm line, and you say, what about this? What about that? And we offer suggestions. And then over a period of days, you guys are calling us with how you figured it out.
Right.
And it's so helpful because then we tell everybody else and then we tell the schools. So we do appreciate that sometimes we put out things that don't sound logical, but you take it and do something really valuable with it. So we want to thank you on that.
Thank you for that. And Sally, is it okay if I step in?
Yes, please do.
So the Child Development Division is working on how to message, and maybe you've already heard from them. We've not seen their statement, but it's our understanding they're not going to require screening for multi-household gatherings, but many childcares do. And if they choose, as Sally said, as long as it's equitable. The links on the other side, the disease outbreaks and positivity rate, I'm not going to get into that. Those links are live. You can look at that. The new information is texting of close contacts, and it's a new system that will help us identify information, get information out quickly as possible so that those who are identified as close contacts. So if you have a positive case in your facility, then and when we meet with you and we say, okay, these 2 adults, these 3 children, or this pod, they can sign up for that text and receive messages. And it also is a chance. There are occasionally families who are unable to answer their phone or, don't recognize a number, so they don't answer it. And this will be a way to text them saying, this is the health department. You've been identified as a close contact, and please pick up the phone so we can finish interviewing you and help you stay safe during your quarantine. And then the last part at the bottom, Sarah Alert. We may have mentioned this before, but the Sarah Alert is specifically for those who are in quarantine to follow their progress. And you can get text messages about your specific quarantine. When is day 1, when is day 7 for testing, when is day 14, when you can, if you don't already have your results, when you can be released. And if you have any questions, you can, or symptoms, you can put that in that Sarah Alert, and somebody will get in touch with you when you have specific questions. So it's a real nice way to have an automatic calendar with a touch point on the health department for any questions. The Sarah Alert does not track your whereabouts. And Chris was nice enough to remind us, go ahead. Chris was nice enough to remind us of the question of how do we celebrate these winter holidays when we're trying to keep people socially distanced. And Chris, I'll let you explain your example, but I know that I've seen some pictures of Santa and children kind of side by side with a plexiglass in the middle. Plexiglass is great, but it doesn't protect you when you need the 6 feet. So children can be 3 feet apart. And I know there are times they play and whatever, and you hold kids, but when possible, but an adult, so a Santa, needs to be 6 feet from children, regardless of whether there's a plexiglass barrier. But Chris, did you want to share your creative idea? It sounds amazing.
Yeah, one of the things that we're doing here is we're bringing Santa to our outside area, which has been set up with furniture and a Christmas tree, and it is 6 feet from the door. So the children will come out the door. We've set up a pulley from where the children stand to the Christmas tree. They'll put their note to Santa on the pulley. They'll pulley it down. He'll take it off. He'll attach a gift. He'll use the pulley to bring it back to him. And they still get to share their Santa experience. We still get to take a picture of the year Santa came in a mask for them for their memory book. So we've thought of a way to keep the 6 feet, keep the masking, but still allow it to be part of the mission.
That's
Chris,
so great. Go
I
ahead.
love that.
Yeah.
You know, I was thinking about how we as early childhood educators constantly reframe things in our work with kids and with families. And often what we do is we're thinking how to get to yes. We're thinking about how to say what we can do and what we want to have happen. And so this year we have an opportunity to reframe the situation. So rather than saying, oh man, we can't do this, we can't do that, we can say, how creative can we get to do things that are safe? What can we do? And, you know, depending on the ages of the kids in your care, you might even invite them to be a part of the process.
I love that. I just was listening to a childcare provider early this week, we had to interview, and going through all the list of all the things that they're doing. And I was amazed. This person was so organized, and all the things they were doing, they were able to minimize their quarantine right down to a small room, and yet keep the rest of their facility open. And one of the things she was talking about, masking, and she's like, oh yeah, from day one, our 3-year-olds, every one of them has been wearing a mask. Occasionally they need a break, but I mean, it was so matter of fact. You guys are so impressive. And here's, maybe I can start, and Sally's got the details on this, but we know that there are a lot of questions about what is happening in childcare in terms of COVID-19 disease. And since March, these are the numbers, and maybe they seem large to you because anyone who's sick, we don't want that to happen. But it's kind of expected that this is a pandemic. But these numbers are so small and compared to all the other people in Vermont who have been sick. And this is not about a transmission. These are just, they were in care working, or they were children of who tested positive by a contact outside. So this is not about transmission. This is just about the total number from March to date.
Right, and Sharon Lee, I think what you're saying are now that these are I'm wondering about the numbers of the children who, then there's another set of numbers about children or adults who were infected from within the childcare setting. And I think that number is lower than these. Because there's a difference, and I don't have those numbers, there's a difference between, you know, like a teacher being infected by her spouse who works in another work environment and picked it up there, and brought it in externally versus internal transmission. And I think that's maybe half as many as what's here.
Yeah, I'm not sure it's even half. It's much smaller, but this is the total number of individuals who attend care or work in a care who were positive. This is not about transmission because that rate is so low.
Yeah.
In fact, it's so low that we may not be able to actually give you the numbers because that might be identifiable.
I wonder if now is a good time to pose the question, a question that's in the Q&A, sort of on the heels of that. Could you please review the procedure for exclusion of a child whose parent has tested COVID positive?
Lovely. So the parent is positive, so the parent stays home and the child is in quarantine. So the parent is assuming that they have no symptoms and that they stay relatively well throughout their COVID period. Maybe they do get sick, but they recover. Their quarantine, their isolation ends on day 10. So that isolation period is the time and 2 days prior from the test or 2 days prior to symptoms. So that's the infectivity. That's the time the adult is infected. On day 10, that is day 0 for the child. Day 11 is when the child starts their 14-day quarantine with the option to test on day 7. And that's always a hard one because we want them in care, or their siblings or other people in the house. So how does that make sense?
I followed that. I was just thinking about, and so I think if people have more questions, they'll pop them in the Q&A. I was just thinking about the tools that programs might have, or providers will have to help families understand that. And I was just wondering, and I bet there's an answer, and I'm just not popping in my head. But is there a place where providers can point the family, say on the Department of Health website, that would back up what they are telling the family needs to happen?
So can you see this image?
Yeah.
So there are 3 of these, and they were in the slides from last time, and this is a resource slide at the end. So there's the version for those who are close contact, and let's see if I put all 3 on here, and let's see if the next one shows up. But there are links. We can make these links more available to you so that, see this link? So there's 3 images there that describe for you what it looks like. And maybe that's not helpful. I'm watching Brenda's face.
Oh, no, actually, I think it is helpful. It's super helpful, because what it does is it gives people a 1-pager to either send in an email or, put in kids' cubbies, send home in their lunchbox. And I'm just going to answer the question about links. So the links are not live to us, the viewer, right now, but they will be live to you once they are posted on our website. And this entire presentation will be posted. All the slides will be posted on the website. So that's a great question. And yes, if you're trying to click on them now, as I did, they aren't live, but they will be as soon as they're on our website. And then, so some of us are really, really visual learners, and some people just want to hear it. And so a follow-up question to that question that goes in conjunction with these resources is just a further clarity. So pushing it out. So is the child able to attend while the parent is in isolation, or should they also remain home with the parents?
If the child is a close contact, the child must stay home. Because they're close contact. When the child starts their quarantine, the parent can go back to work as long as the child is well and has no symptoms. And even if the child does get sick with COVID and become positive, the parent may can leave the house because they are no longer infectious. So that's where this image might be really help. Let's go back and look at this. No, this is just for the individual who's a close contact, but there's the exact same type of image that shows what happens when your close contact stays home and you with COVID then can leave the house. These nuances get really awkward. And that's why it's so important if you as a facility have, and we can talk about this, if anyone's lived through it and wants to share their details or share questions about it, I would appreciate you doing that. But we can talk you through this, because Sally and I sit in these meetings with childcare providers and help them process how to identify who's a close contact and how to communicate with families. There's now a letter that can be used, right? You don't want to go down the rabbit hole, but
and it is confusing. And our contact tracing team, as you folks probably know, are the experts at this. And sometimes if you call and get me on the phone and start asking me these questions, I avoid answering, because sometimes it's these general principles we're talking about, but then to apply it to a specific situation, it's best to have the expert contact tracer walk you through the timeline. But these are these overall, even if you get on the health department website right now, and you get onto the COVID site, which is right there, and find the chat bot, you can just say, how long do I have to quarantine? And these images will start popping up in the answer.
And
So
there's some really, go ahead.
I want to be sure that we answered Lindsay's question. The child is able to attend care when the parent is in, the child is not able to attend care when the parent is in isolation. So isolation means, if I'm isolating, that means I am sick, I have COVID, and nobody in my household should be spending time with me. Yes, I have an 18-month-old or, a 6-month-old, and I have to hold that baby. So that baby is doing the isolation and the quarantine. I'm doing the quarantine with the baby because I can't leave the baby if the baby is in quarantine.
Yeah. So essentially, a child could be out of care for 2 rounds of quarantining. First, the infected parent or family member, and then their own course.
Yeah.
Right.
Okay.
It could be
So
6
can you explain, on the heels of that, can you explain how necessary the 7-day isolation is before getting tested for asymptomatic people?
7-day quarantine. This is so good. You guys this is just perfect. This is what we struggle with every day, and we're all trying to get our hands around this. Isolation means you're sick. Quarantine means you're in contact with somebody who's sick. And so, yeah, so just isolation, sick. Isolation is sick, because who the heck wants to be in isolation?
But it's still necessary. I think I heard you say it is still necessary for that 7-day quarantine before getting tested, even if you're asymptomatic.
As a close contact, that is correct. Okay. So if you're well and you haven't tested positive, but you're a close contact, you can get tested anytime, but the thing that releases you from quarantine is that test that's done on day 7 or after.
And we have a couple of other questions that I think might be good to put in now. One is, if someone has already had COVID, do they have to quarantine when traveling?
No.
Okay. And then this one gets to confidentiality and giving people important information. So if there's a staff member who has COVID, is that protected health information that cannot be released to other employees? At the same time, we want to keep all of our employees safe and give them accurate information that impacts their health.
So the health department has statutory guidance for the health department when there's somebody's life at risk because of a pandemic or health emergency. But those of us in the public domain don't have that right to share personal information. So let's say you have 10 staff and 2 are out. Well, one might be quarantining because their partner is positive. The other one might be the positive case in your program. People are out for their own personal reasons, and it's always okay to say, we are, as out of an abundance of caution, we have people who are out because they're protecting their health, and we're all ramping up our normal COVID protections. So it's kind of an excuse to remember those protocols.
Right, and often staff choose to share their information with their colleagues anyway.
Right.
That may not always be the case, but that's certainly common practice among childcare staff. So I think this backs up to another one, which is because there seems to be, or at least the perception, if not the reality, that the notification is significantly delayed around contact tracing. And so, delayed notification of close contacts risks program staff and students, or anyone. And so what's your best sort of guidance around that?
So that that is really such an important question. And that's why the moment you hear or the relationships that you've built with your families, they may know. So they go to University of Pediatrics and their child or family member is positive. So the pediatrician calls the family. And when you've built really good relationships with the families, they're going to call you right away. When that happens, call us. That is what our 8-3 line is for. And if you have a known positive case, so it's a child or a staff. So if you know one of your children or your staff is positive because they've told you that they've heard from the doctor's office or the health department, call us. You can call the 863-7240 line, extension 3 or 7 on the weekends, but start with 3, and say your childcare and you know of X person X, how can you help us? And they will. That's 7 days a week. And they work 10-hour days, so they're often there later. They get paid for their long days.
Thank you.
We
don't have any other live questions right now. So I think you have a couple more slides. So I'm just gonna, I'll just keep track of what's coming in.
Sally might have some information on this nap time. It was a great question. That came.
Right. That was a question from, I think, a preschool to CDD, and they emailed to me asking if I knew anything. And I don't know, Chris, was it you or someone came up with this link to a group in New Zealand that apparently advises childcare operators in New Zealand. So I'm working I just was looking through it. It looks good. I just have to check with CDD to see how they want to interpret this information. But it was basically talking about the benefits of napping outside, how to, gauge it, and some obvious things like if it's pouring rain or there's a forest fire going on, it might not be the best thing to be happening, but and that infants, it's different. There's very strict overall guidance around infants and infant safe sleep. So that's what that's about. I don't know if anybody does this or is thinking about this.
We have explored it with our pediatricians in Vermont that are specialized in these kinds of things. And I think the comment was heard that, this isn't unusual in some countries. We're not prompting or promoting this. We're responding to a question that was asked.
I have actually witnessed it. I've traveled over the years extensively in Denmark and spent some big chunks of time there. And I have witnessed programs where, one day I was out, the very first time I saw it, I was out for a run on a street in a little suburb outside of Copenhagen. And I was like, oh my gosh, there are kids sleeping in that, what? And then I realized it was a childcare program. And I don't know, maybe 30 or 40 kids were out sleeping on, in the grass and under the trees. And then I was talking with some friends who lived there, and they said, oh yeah, that's common practice. And then I sort of started noticing it everywhere. So it's actually very widely practiced in Western European countries. And when this question came in, I thought, oh, this is a great conversation to have with the Child Development Division. What would that look like in Vermont? And I am interested to know, and you're welcome to weigh in the Q&A, if you practice. When I was a preschool teacher, we occasionally did this, but it was not a common practice.
One of the things that we've run into, unless I don't see any questions in the Q&A, that we ran into this week in a school, for example, is we set down a scenario and immediately the administrator said, well, we didn't do it this way the first time we did it. And this is really about the science changing and partly the speed of what's happened. I don't know what the numbers are today. Maybe Sally knows that, but there's a lot of hope that if the numbers of those who are positive stay around 100 or less, that we might have actually made a dent in people's behavior and recognizing that they really need to keep socially distanced and not do social gatherings. But things have changed, and because that peak came October, November, Halloween and Thanksgiving, it was really frightening to the leadership in Vermont. And so the process changed so that we could respond with contact tracing. So what you might have seen or heard from in your neighborhood school or district that they did was differently, is because now we're trying to make consistent messaging that allows the contact tracers to move more quickly to the next scenario. And for example, a child in a classroom in September, a health department, our contact tracers would have said, okay, let's see the seating chart. Okay, there's 4 children that were within 6 feet of this student for 15 minutes or more, like half the day or the whole day of school. Let's just send those home to quarantine. And maybe that student who was positive has a special educator or a paraprofessional that works with them very closely. So there's 5 people plus the student who are quarantining, and the student is isolating. The others are quarantining. Now, if that same scenario occurs, we would say the entire classroom will quarantine while the student isolates. And if there was a teacher in that room, say another special or arts teacher did a morning long program and was in there for 4 hours, then we would say, okay, that classroom teacher who's there all day long and the art teacher who spent 4 hours, they all go home. So those are some of the changes that have occurred. And since you all have young children, at this point, all of the children in a group, in a room or pod would be considered a close contact. And I see a question. Can you confirm that any travel outside of the state requires a 14-day quarantine? Yes. If you leave the state, you have to quarantine unless it's for essential travel. So that means the teacher went to take care of and provide care, physical care of somebody in another state, or they had the National Guard job and it was their job to go be away. That's what essential travel. And wondering if you can confirm the recommendation of group size. So that's such a great question, because it seemed like a really common thing back in March and April, even through the summer. We had numbers. Those numbers are not, we're not using those numbers any longer. We did kind of discover that high school kids, if they were positive for COVID and they moved around and changed classes and group activities, for some reason, they are less apt to be having multiple people have to quarantine, because typically they're spending, further distance apart if they're, following the rules. And the groups change. So again, it goes back to that 3 feet for children up to grade 6 and 6 feet for anyone older than grade 6. Does that answer the question? Asked, you may have answered. Where do educators fall on the vaccination schedule for Vermonters? Oh boy, you and school nurses, educators and school nurses need to be right up there. We're all trying to stand in line, and there is actually, I just got off my national colleagues meeting, and they have some where the teachers are tier 2. Educators are considered tier 2 in that state, behind healthcare workers and those who are in long-term care facilities.
So I think we're still deciding the tiers in Vermont.
Yep.
So stay tuned, but yes, teachers and childcare workers are definitely, in the queue at the higher level. So, but first in Vermont, it'll be healthcare workers and residents of long-term care facilities.
You asked earlier, I'll go back to the question in the Q&A, but I was telling you about the 3 different timelines. Here's the timeline for the person who tests positive, who is isolating. And here is the timeline for the person who tests positive but does not have symptoms, and then the close contact. So this was those 3 images. And the question is, anticipate any COVID vaccination requirements issued by the state? Or is it left up to the individual employer? Sally, do you have more on that? I can share what I know.
I don't know how. I know they're working on that type of guidance, but I don't know exactly. I don't think there's going to be any kind of mandate that some people might be hearing about. And Sharon Leah, can you add to that?
I can't answer it, but what I can say is that when it comes to things like other vaccinations, early childhood educators are urged to, strongly encouraged to. I don't know if it will be the same, that we will be encouraged to, urged to, or that we would be required.
I don't know, Sharon Lee, are you hearing anything at the moment? I think it's just strongly encouraged.
Yeah. I mean, we're talking, you got to look at the reality. You've got to first have enough vaccines to vaccinate the whole healthcare workforce, and move from there. So it's the volume and it's the logistics, part that's going to be the challenge.
And another question that has not shown up in the Q&A, but that I've heard people talking about is when the vaccine comes out, so say I'm running a program and I get the vaccine, is there any potential for contract and transmission at that point? So like, do we know what the guidance around that will be?
Contact and transmission related to receiving a vaccine?
Right. So some people are concerned about the vaccine, but perhaps they opt to get it anyway. And then what is, I think I'm relaying this correctly. Like, so would there be any possibility, like, should they take a day off just to be sure, kind of thing, or quarantine?
Is that kind of like the flu question too?
Yeah.
Like, can you get the flu from the? Yeah, it would if they put the virus into the vaccine, but they don't. So there's no viral activity in the vaccines. They take genetic maps and they replicate the map, but there's no crossover. I'd do a much better job if I prepared and looked at the slides on this, but that's the basics. It's like there's nothing in it to give you. And so then therefore you say, well, how does my body build a response to something if it's not the virus? But there's ways to trick the body and say this protein looks like this one. Mm-hmm. So we're going to put this protein in you and your body will go, oh, that looks like, a COVID-19 SARS-CoV-2 vaccine. So we're going to develop this army against that thing that looks like a virus, but it's not the virus.
Yeah, and then I think they expect like usual type of side effects of a sore arm or maybe a little achy, but I haven't heard anything that it seems like people should plan as they get the vaccine to take the next day off, that sort of thing. They expect vaccine to be in next week in the state. And there's a huge, we've been working for months at the health department with partners to do the distribution center. As we hear those meetings, it's, this is what public health is set up to do, this kind of massive population-based distribution of something. And the something is the vaccine, and partnering with the hospitals, federally qualified health centers, physician offices, and pharmacies are a big partner in distributing this. So they've been working on this all summer and fall,
Yeah.
and now it's time, and we'll start, especially with the long-term care. If you've been following the news or have some family or friends who are involved with, that's a really sad story. So we want to make sure those folks are protected first.
Can you speak to the spouse question? So,
Yeah, so I want to get that, but I
Good.
want to do the other one because it disappeared and my brain will lose it. I think the question originally was, where are children in the queue?
Mhm.
And we're pretty sure that children are kind of near the end because of how this disease. Now, if it was another kind of disease, it might be different. But in this case, we're hearing that children will be near the end of the queue. Okay, the spouse question. The home provider spouses. Home provider spouses, that's a really, really good point. I was a home care provider for 10 years. And if my 95-year-old parents were living with me and I was doing childcare, you're darn right they would be in the queue. So I think it's going to be a risk factor determining. So we're trying to minimize risk. So if you're in a household with, everyone is under the age of 40 and healthy and no special health needs, your neighbor who's 65 and has 95-year-old parents, they're gonna get kind of put higher in the risk.
Yeah, we can double check on some of that, the latest thinking on that, and put it in the as we edit up the meeting summary that you're doing. We can get back on that thinking. I'm just not sure.
I love this. Would early childhood educators be considered as teachers? Boy, you better believe they are. You guys are critical because people are so clearly recognizing the need for quality childcare because it's such a critical period. The questions have gone. I pulled this up because this is another one of those changing messages. And you see this one is December 3rd. And there's 4 pages that go with this, and I won't bore you with that. But we were saying when supplies were limited, we were saying don't get tested until day 7 because we don't have the capacity. So if you were a close contact or if you were a known close contact or had traveled out of state, we would say, oh, don't get tested until day 7. But now if you had a meeting this afternoon with the health department because somebody was positive and 10 people, including the children, were asked to quarantine, we would invite, those people would be invited to get tested as soon as they wished, but knowing that they can't be excused from quarantine until they have a test that's at least day 7 or later. So that's new, and information travels in different ways, and we have to sometimes take the old information that we learned a month ago and put it with today's information, and it gets mixed up. So, just be patient with us. We're so glad that you're there, and we want you to keep calling us, but understand that it's hard to work through the nuances and it's complex for you.
And some of this is too, additional testing opportunities are available. Many months ago, we didn't have enough test kits and we didn't have enough test sites. So as we've seen more cases in Vermont, the governor and our commissioner have worked with Department of Public Safety and all the other National Guard to set up a lot more sites. The ideal is that there is a site within a 30-minute drive of every Vermonter statewide. And there's not, and then with all the community spread and the higher number of daily cases, the commissioner is asking us, if you think you've been exposed, just go get tested. Yep. And as Sharon Lee has been saying, it's not, there may be an additional test at day 7 to confirm, but they're just saying, go out and get tested. And that's part of our strategies in controlling this community spread.
Is there any interest in looking at the website for what it is to test? Because I can tell you that when you go to the website to find out where the testing, you might see 50 test sites and you go, but there's nothing near me on a day I'm available. So you need to go to the bottom of that list, and there's another section where you can either put in your zip code, and you might discover 4 more sites, like at the Kinney Drug or what, whatever. And then there's what is it called? It's not on board, on demand. On demand. Yeah. So put your name in there, and that will get you in the queue for a place near you as well. That also lets the health department know, oh, we have a demand here for 40 people that are asking to be tested because their neighbor was positive. And so they're more apt to be able to put up a pop-up. This we asked last time, and I don't know if this is the same people, so I won't go into it, but if you want some fun ideas for kids, there's a whole lot here, but I specifically chose the link directly to preschool and under ages. And then Sally can really speak to this. Taking care of ourselves is really, really critical. We're hearing from families and from school students and from teachers where individuals who were positive, they feel horrible for being the cause of a shutdown or a remote learning. Even when you're well, it's hard.
Mm-hmm. Right. So this, we're hearing from, teachers and students, and you folks too are hearing this or maybe feeling it yourself if you're involved as a positive, or you did something innocently, but innocently helped to promote some contagion in the childcare, that people feel very guilty about that. So like this is just an example that Sharon Lee pulled up with the suicide hotline, et cetera, but there's also that crisis text line is not, some people think it's just for people considering suicide, but it's for anyone with any kind of a mental health, just getting into, how sometimes you can feel you're getting into an anxious state that doesn't seem normal. You're welcome to use that crisis text line. And there's other resources on our website and also Department of Mental Health. Sarah Squirrel, the Commissioner of Mental Health, was talking about this in the press conference the other day, just how stressful this is for all of us. And I just, again, we want to call you folks out as being frontline community leaders and trying to keep families, making it seem like this, trying to keep it as normal as possible. And that might be an additional stress on you folks too. So just to know that these resources are out there.
I would jump in here also to say that if you work for a program that that uses the Employee Assistance Program as an added benefits package,
perfect.
access your EAP.
Yeah.
Vermont EAP is really they have people like, they have people who respond, and often if you call your EAP number, it will you'll get a live person, and they're very qualified to walk alongside and listen well, etc. I want to note that we have 5 minutes until the hour. And so right now the Q&A box is empty. If folks have another question, or also just, I want to give you the opportunity, Sally and Sharon Lee, to go through the remainder of your slides, and then we'll do a quick wrap up.
So in case there were people who were here last time, I didn't review the things I just flipped through, but I did want to cover something that came up in the last 2 weeks. And for public pre-K and in general, child care licensing CDD is asking child care providers to, and this comes to funding. So depending on what reasons you choose for closing, And again, private programs have a little bit different leeway, and certainly those who are operating in their own home with other vulnerable individuals in particular. But when the health department, when you learn, say a child's parent decides is a teacher and is just doing the surveillance testing, there's no symptoms, there's no travel, they're not at risk, or even a child in that sibling's family who's got a runny nose, but there's no contact with COVID, there's no travel, and the child is getting a test for COVID. Everyone else in that family, and then the family of the teacher who did a just random surveillance test, is eligible to continue their life. Even the teacher who's getting a test for health surveillance is specifically, because they're only the teachers that are being tested are those who are asymptomatic. So those who are not known to have traveled to have COVID or be sick. So they're not quarantining. So if the teachers are all tested on Monday, they're continuing their work. So we're asking the same for childcare. And again, if you have questions, that's why this line, the slide I just had up, call us when you have questions. And, is there another question in the Q&A? We would appreciate being able to easily access information. So I'm not sure.
Yeah, so I'll address that. Yeah, there is actually, this goes to the Let's Grow Kids website. It gets posted there. It will be posted within 24 hours, the recording of this conversation, as well as this entire slide, set of slides. And then any conversations that we have with this sort of flesh out things that we maybe didn't, we have more information about, or we didn't get to fully answer, we feel like, oh, there's some more things that we'd like to say, we will put that out on by Monday, by the beginning of the week, I should say. I'm not, maybe Maria can speak to that, but we don't typically send an email, a follow-up email. We just post it on the Let's Grow Kids website. So you can find it there, including so this one, as well as previous conversations with Sally and Sharon Lee. And thank you again, Sally and Sharon Lee, so much for answering the questions from the field, people who are living in this, living with these questions in real life. And again, as Sally mentioned at the beginning, this is the last scheduled conversation with these folks from the Department of Health for this year, but we'll take it up again in January if you want to. Really what we want to do is offer to you what is helpful. So you can let us know, you can email, you can contact Let's Grow Kids. Again, you can go to our site and contact us and just say, hey, I'd love those Department of Health conversations to continue. Also, I'm so grateful that you can call the numbers that are on this slide right now at any time, and they'll give you the best information. And so it looks like right now people are weighing in and saying, please continue. So we may be seeing you.
Sure.
All right. Well, thank you.
That's
And
good.
thank you, Chris and Maria and Brenda. I know we don't talk about this, but because we always say the number 863, but the toll-free number for that same thing is right here underneath.
And it is sorry.
And you can leave a message anytime, 24/7 on that line. If you have a question at 10 o'clock at Sunday night or Saturday night, hopefully you're not thinking about work on Saturday night, but just call and leave a message and we'll get it when we're available. And thank you all.
Remember that you can share the creative ways that you lived into finding solutions and ways to carry on. Thank you so much for your time. It's 2:02 and I know you have to hop off. Bye.
Thanks again. This is great. Thank you. Thanks,
You
Brenda.
guys are really, really solid. It's so good. Thank you.
Okay.